Hey everybody, I'm Dr. Blake Schusterman. I'm a board certified nephrologist and I'm also the cooking doc. Thanks for joining me this week. Today we're going to talk a little bit about kidney disease. I know we go back and forth a little bit between kidney disease and cooking, but that's all I know. So today, I diagnose a lot of people with kidney disease, and I understand how frightening and how fearful it can make somebody. And that's understandable because the prospect of kidney failure and dialysis is terribly overwhelming. So today I'm going to go through 10 things that I think are really important if you've been diagnosed with kidney disease, the first things to think about and what to do next. Make sure you click that subscribe button and hit that bell so you never miss a new recipe or a new health tip. First, don't despair. There are many different levels of kidney disease, and a diagnosis of kidney disease, if you're just getting that, doesn't necessarily mean that you're going to end up on dialysis or end up with a kidney transplant. Many people with kidney disease do just fine with stable kidney levels for the rest of their life. So before you panic and before you turn to Dr. Google for all of your health information and fear about what could possibly happen to you, make sure you get some more information so you can appropriately understand your kidney levels, but please don't despair until ask your doctor about your estimated glomerular filtration rate and your stage of kidney disease. There are 5 stages of kidney disease, and it depends on how well your kidneys are actually filtering out the waste products in your blood. Find out your stage of kidney disease, put it in your wallet. That way, when anybody asks you, and if you can't remember it off the top of your head, you've got it right there and available for your other doctors or health providers to see. Next, ask about your cause of kidney disease. Sure, a lot of times we kidney doctors don't know exactly what caused your kidneys to be abnormal, but as you, as a person with kidney disease, go through the process, understanding what's caused your kidney disease and how to prevent it from getting worse can be very important. Lots of medicines can affect the way the kidneys actually work. So there are certain medicines that can harm the kidneys over time. There are also certain medicines whose doses need to be changed, or medicines that need to be stopped if the kidneys are not filtering as well as normal, healthy kidneys. So talk to your doctor, get a list of your medicines, and make sure you go through every single one to make sure they're still safe for you to take in the setting of a diagnosis of kidney disease. Ask your physician or the person that's diagnosed you with kidney disease if you need to see a nephrologist. I'm a nephrologist, so a nephrologist is somebody who specifically takes care of diseases of the kidney where the kidneys are having trouble filtering or they're leaking protein or blood into the urine. That's what a nephrologist does, and we can often help manage the risk factors for progression of kidney disease and make sure you are set up to do everything that you possibly can to keep your kidneys stable over time. Get a copy of your labs to see if you have high potassium. The diet for people with kidney disease often depends on what the potassium level is in your blood. So get a copy of your blood work, ask your physician or provider if you have high potassium, and that leads us to the next step. Dietitians are your friend, they're my friend, they are amazing. Find a good one in your area and ask to be referred. Dietary management is key to help preventing kidney disease from getting worse and help managing some of the side effects and abnormal labs associated with kidney disease. Call your parents. And I don't say that because you're looking to them for support, but you can certainly use them for that if you want. But I want to know, who else in your family has kidney disease? Do you have aunts, uncles, brothers, sisters, grandparents that have kidney disease? There are certain types of kidney disease that run in families, and the more we as doctors know about your family history, the more we can help make sure you're getting the right treatment for your kidney disease. It also helps us figure out if your kidney disease is going to get worse over time, or if we're able to likely manage it and keep those kidney levels stable. Take control of your diabetes and high blood pressure. These are the two leading causes of kidney disease, and managing your diabetes better and managing your blood pressure better can help maintain your health and your kidneys health and your heart health and your brain health over the long term. So now is the time to take control of these health problems. If you have them, don't let another day pass, but try to take your medicines on time, try to adjust your diet. This is the chance for you to make a difference in your kidney health. Lastly, find a good resource on diet and how it affects your kidney health. There are lots of resources on the internet. I'm biased because I wrote a book, The Cooking Doc's Kidney Healthy Cooking, a modern 10-step guide to managing and preventing kidney disease. This book has 10 easy steps for you to follow if you've been diagnosed with kidney disease. We've got charts to help you quit your soda, ideas for how much you need to drink. We've got beautiful pictures to help you season your food in a way that doesn't have a lot of salt. And we've got more than 50 recipes here at the end to really help you incorporate a kidney healthy diet into your daily routine. So I'm Dr. Blake Schusterman. Thank you for watching. I'm a kidney doctor and I'm also the Cooking Doc. Make sure you subscribe to my channel. Check me out on my website, thecookingdoc.co. My book is available on Amazon, or you can also download it from my website, thecookingdoc.co, if you want an e-copy. Thank you so much for joining me. Make sure you comment. Let me know what other questions or concerns you have about kidney disease. We'll see you next time.